What if the most powerful treatment for type 2 diabetes wasn't a pill, an injection, or a prescription at all, but a set of changes so fundamental that they challenge everything modern medicine has quietly relied on for decades? Because when people ask whether type 2 diabetes can be reversed without medication, they're really asking a deeper question. Is my body broken forever? Or does it still have the capacity to heal if I remove the conditions that made it sick in the first place? And the honest scientific answer is neither a simple yes nor a dismissive no, but a nuanced truth that sits uncomfortably between hope and responsibility, because type 2 diabetes is not a disease that suddenly appears out of nowhere. It is the final stage of years of metabolic overload, insulin resistance, and silent damage, driven by excess energy intake, physical inactivity, chronic stress, poor sleep, and a food environment designed to overwhelm human biology. And understanding this process is the key to understanding whether medication-free reversal is possible. To begin with clarity, we must define what reversed actually means in medical terms, because science does not recognize vague promises, only measurable outcomes. And in clinical practice, reversal usually means remission, where blood glucose levels, measured by HbA1c, fall below the diabetic range and remain there for a sustained period without glucose-lowering medication. And this is not hypothetical. It has been demonstrated repeatedly in well-designed studies, particularly among people who intervene early. But remission is not a cure, because the underlying susceptibility remains, and if the metabolic pressures return, so does the diabetes, which immediately exposes the danger of online claims that promise permanent freedom with no effort or vigilance. The core biological driver of type 2 diabetes is insulin resistance, especially in the liver and muscles, combined with fat accumulation in the liver and pancreas, which interferes with insulin signaling and insulin secretion. And the most effective non-drug strategy for reversing this process is sustained weight loss, not cosmetic weight loss, but meaningful reduction of visceral and ectopic fat. Because when this fat burden decreases, insulin sensitivity improves, hepatic glucose output falls, and pancreatic beta cells can partially recover their function, allowing glucose levels to normalize. And this is precisely what landmark studies like the UK DIRECT trial demonstrated, where intensive dietary intervention led to diabetes remission in a significant proportion of participants without medication, especially among those who lost more than 10 to 15% of their body weight. However, weight loss is not magic, it is a biological lever, and how you achieve it matters far less than whether you can sustain it, which is why extreme diets often succeed briefly and then fail long-term, not because the science is wrong, but because humans are not robots, and adherence is the limiting factor. Low-carbohydrate diets can reduce glucose spikes and insulin demand. Intermittent fasting can reduce overall energy intake and improve insulin sensitivity. Plant-based diets can reduce calorie density and inflammation. And all of these approaches can work, but none of them work universally. And none of them bypass the fundamental requirement of sustained metabolic improvement, which is why the question should never be which diet is best, but rather which diet can you live with for years without breaking your mental or social health. Physical activity plays a crucial but often misunderstood role, because exercise alone rarely causes dramatic weight loss, but it profoundly improves insulin sensitivity, particularly in skeletal muscle, which is the body's largest glucose sink. And resistance training is especially important because muscle mass increases glucose uptake even at rest, meaning two people with identical weights can have very different metabolic health depending on muscle composition. And this is particularly relevant for individuals who develop type 2 diabetes at lower body weights, including many South Asians, where visceral fat and muscle insulin resistance matter more than BMI. Sleep and stress are often dismissed as lifestyle fluff, but chronically elevated cortisol worsens insulin resistance, promotes visceral fat storage, and disrupts glucose regulation. while sleep deprivation independently increases diabetes risk even in the absence of weight gain, meaning that any serious attempt at medication-free remission that ignores sleep and stress is biologically incomplete. Now we need to address a critical and uncomfortable truth. Not everyone can reverse type 2 diabetes without medication, and pretending otherwise is not empowering, it is cruel. Because duration of disease matters enormously, and the longer diabetes has been present, the more pancreatic beta cells are lost to glucose toxicity, reducing the body's ability to recover insulin secretion, which is why early diagnosis and early intervention are so powerful, and why some people who do everything right still need medication, not because they failed, but because biology has limits. This brings us to one of the most harmful myths in diabetes culture, the idea that using medication means you didn't try hard enough, because medication is not a moral failure, it is a tool. And many people achieve remission with a combination of lifestyle change and medication before later maintaining normal glucose levels without it. And even for those who never come off medication, improving insulin sensitivity and reducing cardiovascular risk is a success, not a defeat, because the ultimate goal is not ideological purity, it is preventing heart attacks, strokes, kidney failure, blindness, and premature death. Bariatric surgery deserves mention because it produces the highest rates of remission, often before significant weight loss occurs, highlighting the powerful hormonal effects of gut incretins on insulin sensitivity. But surgery is not medication-free in spirit. It is a serious medical intervention with lifelong implications, and it reinforces the central lesson that biology responds dramatically when energy balance and hormonal signaling are fundamentally altered. One of the most dangerous ideas promoted online is that supplements, detoxes, or natural cures can reverse diabetes independently. Because while some supplements may modestly affect glucose metabolism, none address the core drivers of insulin resistance in a meaningful, durable way. And relying on them instead of proven strategies delays effective intervention and increases the risk of complications. From a public health perspective, framing diabetes reversal as purely an individual responsibility ignores the reality that food systems, urban design, work patterns, socioeconomic stress, and marketing all push people toward metabolic disease. And while individuals can and do succeed, sustainable solutions require environments that support healthier defaults, not constant willpower. So, what actually works without medication is not a single trick, but a convergence of factors: early intervention, sustained weight loss where appropriate, improved muscle insulin sensitivity through resistance training, reduced glucose exposure through dietary consistency, adequate sleep, stress management, and realistic expectations. And when these conditions align, remission is not rare, it is reproducible, but it is also fragile because metabolic memory persists and vigilance must continue even when blood tests normalize. The most important message for anyone watching this is that improvement is always meaningful, even if complete remission is not achieved, because lowering HbA1c, reducing insulin resistance, and improving cardiovascular fitness dramatically reduce long-term risk. And this reframes success from an all-or-nothing outcome to a trajectory toward better health. So, can type 2 diabetes be reversed without medication? The evidence-based answer is that for some people, particularly those diagnosed early and able to sustain major lifestyle changes, yes, remission without medication is possible, but for others, medication remains a necessary and valid part of care, and both paths deserve respect, support, and honesty. Because medicine should guide people toward reality, not shame them with absolutes. If you found this breakdown clear, balanced, and free from false promises, then subscribe to MedLogic. Because this channel exists to cut through medical myths with science, compassion, and clarity, and your subscription helps us bring evidence-based health education to more people who need truth, not hype.